I met Sally, I think it was 1978, at the annual conference on human rights and psychiatric depression.
I'm sure Jay's accurate, more accurate than I, because I don't remember that, but I remember that when we totally really connected.
The experience I had that made me want to become a mental health advocate was my own personal experience in the public mental health system. I spent 50 years in the public mental health system, 10 years trying to survive it, and 40 years trying to change it.
My personal experience as Jay just changed my whole life around. Previously, I had been working on a PhD to become an English teacher, and it was in the private mental health system. Actually, a community facilities, this old farmhouse with little farm cottages on it. I knew then, it was very clear that someday I would be back to do something about this and change it for others that followed.
For me, the accomplishments that I feel most proud about was the forming of a group called Mental Health Consumer Concerns, which was a group that wanted to be the patient rights advocate for, at that point it was Alameda County. At that time, one of the biggest issues was the way people's rights were abused and locked up against your will, and forced medication and restraints. So rights were a very important issue to the movement in the beginning. And the other important thing for me was the California Network of Mental Health Clients. I thought that was a major step.
When I came to California, I remember people talking about, well, we have a lot of advocacy, we need direct services, and I had in my mind that I wanted to help start a consumer-run drop-in center, which were sort of the forerunners of what people are calling recovery centers now, recovery wellness centers. It is the genesis of the consumer-run wellness recovery centers of today.
To me, there's been tremendous changes in the public mental health system, although we still have a long ways to go.
We came into the mental health system, once you were diagnosed with mental illness, you'd be mentally ill the rest of your life. That's what you were told.
Right.
It was like a downward trajectory, except research proved that wasn't true. And slowly, the system started understanding that recovery happens all the time and can for everybody.
The stigma leads to people not getting hired, it leads to them not getting homes, it leads to them not having friends. There are so many ways that people's attitudes toward people with mental health issues are keeping people from being full members of society.
I think the stereotypes of people with mental disabilities or people who've been diagnosed with mental illness as violent, as incompetent, are the base for the prejudice and discrimination that Jay talked about.
One of the most rewarding parts is to see the way the youth have really come aboard to and are concerned about the issues that we've brought up today, and it's been exciting to see the accomplishments.
I want to thank you for helping Californians believe that each mind matters.